Hello, everybody, and welcome to today's success story interview, where we are going to be talking with our friend Stephanie about her success this application season for residency. So, welcome, Stephanie.
Hi, thank you for having me.
Definitely. I'm really excited to dive into everything today with you. So, why don't you just start out by telling us a little bit about your match? Where did you match? Which specialty?
Okay, well, I applied into family medicine. I currently go to SGU, St. George's University. So my where I applied to is in Georgia. That's where I actually kind of not grew up, but like it was a part of my life. I spent a good amount of a chunk of my life. So I applied to WELLSTAR Kennestone, which was my number one choice. That's located in Marietta, Georgia, aka Atlanta, aka whatever you want to call it.
Yeah,
But yeah, so I applied there, got there my number one choice. So I'm very, very
nice.
excited.
Yeah, it's amazing. What made it number one for you?
For me, honestly, virtual was kind of difficult this year, right? So I had a friend who actually was in the program already, and me and her have similar personalities, and her being there as an intern kind of gave me a better insight on the program. So we had to be creative this time. So for her, and then also getting able to speak with them, a good amount of them, like during virtual conference and things like that, it was able to draw me in closer to them. So I fell in love with them prior to the application cycle, and it was mainly because of her. So she
Nice.
gave me a good insight.
Yeah, so you had a little insight into the program. And
Exactly.
then what about that program? What were you looking for in terms of the atmosphere or the opportunities that's really drew you to that family medicine program?
Yeah. So for me, the program, I'm really mainly about support, right? So going into residency, it's about, who your peers, like the staff, and how supportive they are. And I was like honing into like the supportive nature and atmosphere of the program as a whole. So me being able to speak to the residents and being able to speak to the PD, I was able to talk to her on the phone prior to application cycle. So that spoke volumes to me about how, like, she's really into her program and the people that's in it. So it just basically showed me how the programs and what their values, their morals are. And that's what drew me closer to it. So yeah.
Amazing. And did you apply outside of family medicine or was it just family medicine?
It was actually only family medicine. I know I get asked this question a lot because I know in this field they tend to always say, "Oh, when you apply to family medicine as a backup." And I know that gets very difficult sometimes, especially for the program directors trying to hone into people who actually really want to do it versus the people that are doing it for backup. But I was one of the people that is a primary care girl. I love primary care, and I was torn between internal and family. So family was where my heart was for a lot of reasons. So yeah, only family med for me.
When did you realize that family medicine was the specialty that you were going to dedicate your life to?
Yeah. So for me, I realized it during my third year, honestly. Going in my second year, I already knew, even starting medical school, I knew primary care all day. So then that's when you start to like dig deeper, like, okay, what's a part of primary care? Then I was torn between internal and family. So when I like got onto my internal medicine rotation, that's when for me, which happened to be my first rotation, was for me that showed me, yeah, I think I want to do family because there were certain aspects of internal that was missing for me. And it's like we know it's personality based, is what you like. So you have to go into it with an open mind, try to see where you fit in. And for me, family, I just love the fact that I can deal with everybody, all ages, versus internals mainly adult medicine. So I felt like missing out on the kiddos is what like was kind of like hard for me. So I knew family medicine all day.
Yeah, perfect. Yeah, I think that sounds really great. And it seems like you were able to really hone in on that aspect of your personality to have
Exactly.
that reflected in the specialty you're looking for.
Yep.
What did you do to help make programs know that you were truly interested in family medicine for it aligning with you personally?
Yes. So a lot of people, I mean, people know about it, but a lot of people actually don't attend these things. So the conferences of each specialty, right? And a lot of times it's happening during your third year. So I tell people to, when you go into your third year, definitely try to figure out what you like, what you don't like, so that when the conferences come, you can actually attend any one. And they start like early, from what I understand, like early spring, and it goes all the way into like your fourth or fall or whatever. So for me, I would say going to these conferences, and because with that, there are a lot of programs that come out. You get to talk hand in one on one with program directors, program coordinators, residents, and to really get a feel of these programs. So that's where it started for me, is the actual conferences. Yeah.
Nice. Yeah. And so when you were actually starting to fill out your ARIS application and do your personal statements and letters of recommendation, what did you include in that application to help also make sure that you were a strong candidate for family medicine?
I included everything. Everything that you can think of that I felt that will be um, a beneficial factor towards who I am as a person, right? So a lot of these specialties or programs are looking for, what else do you bring outside of your merits, right? What else do you bring outside of your grades? And I know that I did a lot. I mean, I got called out about that in like almost every interview, like, wow, what have you not done? So I
Yeah.
feel like I feel like getting heavily involved, even if it's things that are not correlated with medicine, like, just to show who you are, what your interests are outside of medicine. They love seeing that. So show who you are as a person, what you like, your hobbies. For me, I did a lot of things. I already knew from going into family, I wanted to do integrative medicine, and it's a growing type of special or field or direction in family medicine. So I was a part of like research. I even presented it about it. In my master's program, even when it comes to tutoring, mentoring, when it comes to just joining different organizations, volunteering, like different things that can show who you are outside of medicine is what I added and what they love. So yeah.
What did you have for your hobby section?
Yeah. So I was, prior to medical school, I was a professional hip hop dancer. So
Oh,
they
wow.
loved, exactly. I got that in
Yeah.
reaction every time. Like, oh, what did you do? What was that? And they love talking about that. Also for me, I love yoga. I'm very into like the arts, music. I love cooking. So I spoke about different things like that. Hobbies, other hobbies that I love to do outside of, of course, studying and things like that. I love hanging out with friends and family. They love hearing that. Who are you? Are you a regular person outside of medicine? So I added those things and what I did with those things, as far as like mentorship. I joined organizations to mentor the youth, or volunteer with tutoring to help out like my peers or the youth. So I just talked about a lot of other things that I started. I started other organizations when I was younger. I talked about that. That's still going on today. So they loved hearing, like, what did you do before medicine and outside of medicine?
Can you tell us a little bit more about the integrative medicine aspect of family medicine? And it sounds like some of your hobbies even relate to that aspect of your
Yeah.
interest in medicine and family medicine in particular.
Yeah, so for me, it started off for me like with my mom. So I had lost my mom to breast cancer some years ago, which
Oh,
kind of like focused and geared me towards medicine, right? So I wanted to figure out, and that's when I started to hone into like, okay, what are natural things that we can do to help the body? I truly believe in the body and its capacity and what it's able to do, right? So I truly believe in natural ways, holistic measures prior to going the conventional route, which is the surgeries, the medications. Let's see what we can do to prevent that first. And then if we need to add that. So that's kind of the integrative medicine approach, is let's see holistically what we can do. Let's view your social economic status. What do you do? What are stress factors around you? Do you exercise? What is your nutrition? What's your diet? Different things like that that we can work on first, de-stress you, that we can add to your habits that can actually help and elevate you, things like that, before we can say like, okay, those things aren't working, let's give you the medicine now, or let's take you to the surgery. So that's the integrative approach. And it's a growing field, but a lot more people, especially the patients, are coming in asking what are alternatives, right? So it's forcing physicians to actually dig deeper and see what are alternatives, what can we do differently. So yeah.
have you been able to experience that in the medical field, whether that was in rotations or any other sort of medical experiences that you've had as a training physician?
Yeah. So when I started SGU, they had there was this, I guess there was a study that was going on, and they were looking for participants. So I actually was a participant in a study that got published like 2 years ago. And it was looking at acupuncture's particular areas in the ear and how it can affect your weight in weight loss in certain areas. So it was like things like that that I like decided to like, let me see, being a part of a research part, who can say that? Like I was an actual participant that helped with the numbers of a study. So that can actually help with this field of medicine. So doing that, also I was a part of a selective SGU. They had an integrative medicine selective, which had different people coming in talking about different fruits or different diets or different things that they can approach holistically, different type of physicians that are in this field that can talk about it. So yeah, just kind of me looking at different ways outside of medicine that I can actually incorporate and that can allow me to further open my eyes towards this field, right? So just joining a study, digging deeper into the field. I did research on it in my master's program to present it as a presentation, different things like that to help me to see deeper what this field is about.
That's really incredible. What was your master's degree in?
Medical science, and I did it at Hampton University. It was 2 years. Yeah. So it was awesome.
Were you able to discuss this aspect of integrative medicine throughout your interviews when you
Yep.
were taking the residency interviews?
Yep. I actually specifically targeted programs that had some kind of exposure to integrative medicine, right?
Yeah.
And so for me, the program that I'm in right now, it's fairly new. So that's another thing that I liked. It's like I will be the fourth class. I love that because they're more open to the ideas of residents and bringing new things to the table, right? There's other programs that already have it entailed in their curriculum specifically, or there's other ways that you can get exposed to it through like your electives, or whether it's like, oh, we have a course that you can take outside of this that you can like, kind of get a feel. And DOs kind of have, if your program has DOs in it as well, they bring some kind of integrative medicine approach as well, because they talk about the osteopathic approach, right? So it's different things that I targeted towards programs that I wanted to make sure I got some exposure, or I can bring my ideas to elevate the program with this exposure. So yeah.
What would you say was the best thing that you were able to bring to the interviews in terms of preparation or just making sure that you performed well or had a positive impact on programs when you were taking the interviews?
So the best thing for me was my personality. So I just brought myself. I just love
Yeah.
having conversations. I'm very confident. I mean, I just tell people to just be you. I know I understand the stressors of the interview process, and it's like, oh my gosh, they're judging me. But in aspect, we're actually looking at to see if we're a great match, right? So you got to fully be you so that they can be themselves as well. I also like did a lot of preparation, right? So going into, because you don't know, you're not aware of what they're going to ask or how these interview processes are going to be. Of course, you get your advice from other peers that have gone through it, but you still don't know because you've never gone through it yourself. So the preparation part was key. I definitely did a lot of research on the different type of questions that are like common. I made sure I had some kind of response to it, right? I don't say memorize your answers, but I can definitely say put a bullet point so that when it comes up, you could just actually talk about it. Because you have done it, you can just talk about however you want to go, right? In the direction you want to go. Also, the main question that a lot of people struggle with is the tell me about yourself question. I prepare for that like nobody's business.
Yeah.
Like I literally had to like get down to the nitty gritty because you have to think about a pitch that you only have 2 to 3 minutes to explain so they can get a kind of synopsis about you without having to question and trying to figure you out after that, right? So I had to dig deep on what were the main topics I wanted to talk about. What were things that I feel that stood out? And you can make it broad to where it's like, oh, there's something you mentioned your response. Can you further explain that? So you don't have to go into like detail when you say things. Just kind of say like I was a leader and blah blah blah. Or I started this organization. I'm an innovator. I'm this. So they're like, oh, you're an innovator. Can you tell me a little bit more about how So it's kind of like you figuring out who you are and how you want to like break this down to the way that it's only 2 to 3 minutes, but explains everything about you. And that takes time. And also after you do that, you practice with someone, right? Someone that's probably in the field or not, someone that can actually say like, oh yeah, I love the way that you come out very interesting. I actually probably want to get to know you more. Or you could probably take that out. They'll give you advice on what to do. And I feel like after that, like I'm telling you, once I figured that out, I literally prepared for the first interview and didn't have to prepare ever again. Like the only thing that I did was research the program the day before to kind of see what questions I wanted to ask. If you knew the different people you were interviewing, look them up as well. See if you have any kind of relations to them. Bring up things so that you can keep a conversation going. The whole point of interview is to have a conversation. So to keep it going, bring up points that you saw in their synopsis. Bring up points that, oh, I relate to you in that aspect. Explain that to me, or just different things about the program that you would further like to talk about. They love that, to know that you did research on them. So preparation was key, key,
Yeah.
key. But after you get the preparation out, you don't have to stress out anymore after like that. Literally, I didn't have to prepare after that. Like I literally didn't.
So it was a lot of preparation in the beginning and kind
Yep,
of getting through the nerves of the first interview, and
yep,
then just smooth sailing after that.
exactly. I
Being
had a
comfortable.
great time. I had a great
Yeah.
time. So
But have fun with it if you can, right? That's
exactly,
the
exactly.
goal.
Get those nerves out. Like they know that you're nervous. They understand that. But right now they're looking at, do you fit? Are you someone that we can see being personable? Are you someone that we can relate to? So being timid, I spoke to a program director, an APD even after that. Like, okay, tell me, what is it that you all were looking for in these interviews when you interview people? Because of course, everybody that applies, majority of the time, we have stellar merits, right? But it's like who you are as a person is what matters the most. What kind of energy do you bring? They kept telling me, Stephanie, it's about your energy was amazing, amazing. It was infectious. Like I loved talking to you. They love that because then that shows that I can see you in the hospitals with me. I can see you being someone I can train or being personable or the patients will love. So just be you. Get the nerves out. They love that.
Did any questions throw you off or surprise you when you were in the interview process?
Yes. For the most part, they were pretty common, right? But I did have a couple of them that were like, where did you get this question from? Like, what? How is this going to like help you? Like for instance, one of the questions I could think about was, they asked something like, if you were no longer living and they had a Wikipedia page on you, what would be the first three sentences of the Wikipedia page explaining you? And I'm like, what? So just think about how you have to come up off top of your head, like, what am I going to say without sounding too cocky? Or how can I create three sentences? And like, you have to, because the interviews were only like 15, 20 minutes or even 25 minutes long. So you don't have that much time to spend on a question. So that one question threw me off. I've never had any other question like that because I didn't know what to say. So yeah, of course you would have questions that would throw you off. But I think with these questions, they're looking at personality. They're looking at how you will respond to that. So prepare as best as you can with the common questions. Get a kind of synopsis on what kind of questions they may ask. But there are for sure going to be questions that will throw you off. And it's okay, because I'm sure that question threw everybody off, you know.
Right.
So it's fine. For sure.
And did you follow up with programs after your interviews?
I surely did. So I've heard different things like try to communicate with them within a week after you interview, right? I actually did it within a day to 2 days. Like I literally was sending them a response because you got to think about these people are interviewing like almost every day. So for you to stand out or for them to remember you, you don't want to wait a week later. By that time, they've done like 5, 6, maybe 10 interviews with multiple people within one interview. So you have to try to be as diligent as possible. Make sure you stay proactive, sending emails, letting them know if it's things that you remembered in your interview that was very specific to just you and that person. Bring that up in the email that you send them. Like, hey, I loved when we talk about that. I thought it was brilliant. I thought that was amazing. But so they can remember. I had programs or different people I interviewed with when they responded back remembered our conversation. So it's paying attention to those things in your interview so you can write something right back. Then I also heard about like, the letter of intent or the letter of interest. When you send a letter of intent, make sure it's only to one program.
Hmm.
Of intent is specific to you are my number one. I want you to choose me, and here is ABCY, right? You cannot send letter of intent to multiple programs because somehow they say they can find out, or it's just one of those things of just having integrity, right? So don't lie. If this is your program, send that to one program. And the other things can just be like, hey, like I can see myself doing well or thriving in your program. If like you're number two, you're number three, right? But definitely I waited till like near the end of the interview season to send my letters of intent and letter of interest, but the actual like post thank yous were after the interviews, right? So a day after the interviews, just to let them know, hey, how you doing? Yeah, so like that. So definitely follow up, and
Follow
don't
up.
be upset if they don't respond. Okay. You
Right.
have to remember they have so many of these emails coming in, but I do know that they do look at it and they do add it to your file, right? So if they're looking at your file, they can probably look up and see if you've emailed them recently or whatever and read it then. But just because they don't respond doesn't mean they didn't see it. So keep that in mind as well.
So follow up with programs, make it personal, but don't take it personal if they don't respond, right?
Exactly. Exactly. Because my
Now,
number one didn't respond back.
oh,
So just letting you
and you
know.
match, so it's all good.
Exactly.
Yeah.
Exactly.
Now, when you were actually creating your rank order list, what did you have in mind, or did you use any process to help really create that rank order list?
Yes. So I actually used you guys,
Okay,
Match a
great.
Resident. I did. Um, After a while for me, honestly, it did get a lot, right? Because I think after like my eighth interview, I was like, oh my gosh, like, it just started to get overwhelming. But for the most part, it mattered for me in the beginning because it kept it organized. So after the interview process, you will like go into Match a Resident and you'll type up the things, so they can kind of give you the number per program, right? So I definitely use that. But the end game for me was really about you have to think about what your priorities are in every program, and you have to go through each program to see if they match that. Me, my main thing was my location because it was about my support system that was there during residency that mattered the most to me, right? And then also after that, it will be the curriculum. Most programs have similar curriculums at the end of the day, right? Because we all have to pass our certification board exam. So we have to like think about what your priorities are yourself specifically, and then you kind of guide it from there. But it was a no-brainer for me 1 through 3. It was the rest of them that was like, okay, how do I rank this from 4 to like 14, like, or 15? Like, how do I do this? So I literally had to think about other factors like, okay, if I didn't get my 3, would I be okay to go here? The location matters so much more to me. The support system also mattered to me, and just like the program directors, the feel, the love, all of that, because that matters the most when it comes to residency. So it's all dependent on you.
So to clarify, you were using the rank assist tool in Match a
Yes.
Resident?
Yes.
Gotcha.
Yep.
Now, um, what were you feeling during the week leading up to match day when you knew you were matched, but you didn't know where it was going to be? Like, can you tell us a little bit about that?
It was stressful. I remember like the week prior to match day, and I'm speaking of the 15th, so that Monday, I was okay. I think I was trying not to think about it, right? You did your work, you're like, okay. So I was just like relaxing, just doing whatever. And it was literally the day of when it was like an
Yeah.
hour, 2 or 2 hours. And I'm like, oh my God, today is the day I decides my fate, right? So it was stressful. It was definitely stressful. I stayed on the phone with a friend like until that actual minute. Like you figure out what you need to do, but it was definitely stressful. Once I got the congratulations, I was like, okay, yay. But then I think closer to the day of Friday, that's when it started. The anxiety came back like, oh my God, where am I going? I don't know where I'm going. So it was very, very stressful. I don't understand that whole process. Like, they're so rude for that. Like it's like double anxiety, like, like it's so rude. But once you find out where you're I tell people, it's a great thing to match, period, right? And I understand like getting your number one matters so much, but also keep in mind wherever you end up is where you're supposed to be. So I tried not to put too much pressure on that aspect of it, like where I'm going. But to me, yes, it mattered so much because I was like, oh my God, I know what I can and cannot do when I get there because I know Atlanta like the back of my hand, my support system. But if I was not supposed to be there, I would be somewhere else. So also keep that in mind. Just be excited and proud of yourself that you matched, right? The matching where matters, yes, but if you don't give your number one, it's still okay. You matched. A lot of people do not match. So just keep that in mind.
Did you do anything in particular besides the rank list to help make sure that you were targeting your application towards that region or program or that
Yeah.
yeah, place?
Yes. So I definitely, you all were a big help. So I used to watch the lives. I used to watch like, your stories and the things that you posted. So everybody, please check out Match a Resident when it comes to building your application and what to do and what not to do. But I remember in particular, there was this live, I forgot which physician it was. I can't remember his name, but he was awesome. And he brought up a point that I thought is a cute little gem for people if you're trying to target certain areas. So for me, I used to live in Georgia and I really wanted to go to Georgia, right? So there's two parts in your application that you could put an address, which is either your current address and your permanent address. So my current address, I use my home address, which is in North Carolina, and then my permanent address, I use one of a friend's address, or either I think I use no. I use my old address that I used to have prior to like being in New York. I'm currently in New York right now, finishing off my electives. So I use my old address in Atlanta, and a lot of these programs love picking people who are from the area, used to live in the area, because they're about serving their area, right? So keep that in mind when you're putting, these address in your actual application. A lot of that matters. A lot of my interviews were actually in Georgia, in North Carolina area. So just keep that in mind when you're actually doing it. Like I said, there's two areas, and just put those address there. And I'm telling you, it matters. So be aware of that. Programs love dedicating and giving energy to people who actually know the area very well. So just keep that in mind as well. So I use that.
Yeah. Are you planning on staying in that area after residency?
That is the plan. I do plan on doing that, but I'm a person who wants to start a clinic myself,
Uh-huh.
because I definitely want to incorporate the integrative medicine approach in my clinic. I have so many ideas. So I do plan on having more than one clinic, and I have the backing of people in my family that I know also have clinics. That are in the same predicament as me. So when people try to tear me down and say, "Oh, I've had it all along my career," like, "Oh, a clinic," like, yeah, no, like, "Oh, that's going to be hard. How are you going to finance that?" Telling people, you do not know me. Like, I bring so much, my passion, my drive, like, it's unmatched. So I will be starting a clinic, and I definitely plan on having one in North Carolina as well as in Georgia. So yes, I do plan on staying in there for a long haul.
Wonderful. Do you have any final pieces of advice or inputs for anybody who's going to be starting the process to, help get into residency and make sure that they're
Yes.
able to follow their dreams all the way to fruition?
Of course. So I would say start early, right? So one thing that I can say is, especially with the letters of recommendation, I remember as soon as I got into certain rotations, I'm focusing on certain attendings that I know that we're building a relationship, and I'm asking them like within like a week or two in the rotation. Just because I feel like when you do that, they can then hone in on you and your skills and make a more specific, detailed letter of recommendation by the end, right? So ask early. Definitely do that early. Don't wait till the end. I also would say when it comes to the personal statement, make sure you have many people, like get a good amount. I had like two or three people that I felt were definitely significant or played a significant role in this field, to read over my personal statement, right? So make sure you read over that. Do not make it long. They love short and sweet. Keep that in mind. I've had program directors tell me that, because they read multiple personal statements. So short and sweet, straight to the point. And definitely I can say, outside of that, I would say also kind of like, it's about detail. I remember somebody spoke to me during my one of my interviews and said, "We appreciate the time. We could tell that you took time to do this application." So I'm guessing people are not really as, I don't know, like specific or detailed, or maybe a couple of errors. So pay attention to your application and make sure you go over it. Have other people read it as well, because sometimes when when you're reading it over and over, there's small errors that you may not catch because you're so used to reading it, but a fresh pair of eyes can probably catch those errors, right? So definitely have other people read over your personal, not your personal stuff, but your application. Definitely start early. Have no fear. Just go for it, okay? Like, do not let people tell you cannot, just based off of your scores, based off of whatever the case may be, because you never know what these programs are looking for. A lot of times they are looking for people who brings more than merit. So come no matter what. Even if your score is not the norm, stay off of Student Doctor Network too. Please. These are like I tell people run from those because if you listen to Student Doctor Network, you will literally probably just give up on your dream. You wouldn't even try because it's like, no, don't do that. A lot of my mentees, I tell them, stay off of that. Just do what you need to do. Talk to people early. Attend these conferences if you can. They love seeing that because then they know that you're serious about that specialty. Reach out to your mentors, start early, and stay on it. That's my advice. And you will be fine. I promise you will be fine.
Amazing. Yeah, it's really incredible advice. And is there any way that people can stay in contact with you or,
Yeah.
follow your journey and story? Um,
Yes, yes, of course. So my Instagram handle is Dr. underscore Dance Queen. Yes, that's me. So Dr. underscore Dance Queen. You can definitely reach out to me. I have people reach out to me all the time asking me questions. I'm one of those type of people. I love mentoring people. If you need a mentor, I'm here as well. So yeah, you can just reach out to me there, and I'm ready to help.
Wonderful. Well, thank you so much for
Thank
taking the time to
you.
speak to us today and share your story and help inspire the IMG community. It means so much.
Yes,
So thank you again.
thank you. Thank you for having me. You guys can do it. Keep it up.